Good afternoon. We are here with Dr. Patricia Fink. She is the newest board member of OEP, and we're going to be talking to her and asking her about her history, and hopefully she'll get to know you better, and you'll get to know her better. So, Dr. Fink, thank you for joining us.
Thank you for having me.
So, if you could just introduce yourself to everybody.
Hi, I'm Patricia Fink. I practice in Burlington, Ontario, Canada, and I'm excited to be on the board for the OEP.
And your official position starts when?
It starts in July of 2014.
And can you tell us a little bit about your background, where you graduated from?
Yeah, I graduated in 1995 from UNCO after 4 years of a Bachelor of Science degree from McMaster University, and have had an in-office vision therapy practice now for approximately 4 years.
And your office does general primary care as well?
Yes.
And how did your interest in vision therapy really spark? Was it all the way back in school, or how did that work?
Yeah, I had problems fusing through a slit lamp during the ocular disease portion of my schooling, and I actually had to do a 12-week in-office vision therapy program at New Enco's clinic in order to be able to fuse and pass that portion of my test. And so I was introduced in it that way. I also received the OEP brochures for students that was coming through to the dormitory I was living in the first year, so I collected all of that and was happy to get some equipment and lots of information through that venue, and had always been interested in vision therapy, but was never able to get it off the springboard to actually get started. Tried with some home VT, which was unsuccessful in many patients. I did a rotation at the Vision Institute of Canada, and as part of my internship, and which was great. Some great people there that did some amazing stuff, but again, not enough support to actually get it started for it in office. Lots of programs that required books and testing materials that were not accessible to optometrists, so that you kind of get started and then it peters out. So it wasn't until a few years ago that we got started in actually doing the OAP courses.
And when you were doing, can you tell us a little about the therapy that you did when you were in school? Was the only problem that you had fusing in the slit lamp, or were there other, now that you kind of look back, issues that you kind of spot now?
Yeah, it was specifically designed to get me to fuse. There was a large exo, so a lot of convergence work that was done. It wasn't until later that things started to click a little bit better, that there was more issues. I didn't actually have a lot of depth. Especially at distances. I was a high myope that never had any fill-ins until I started optometry school. So, of course, that was very easily corrected within the first year of me being at school. My myopia increased a good diopter and a half within the first 2 years of being in school. And amazing when I had my first pair of glasses with astigmatism in them that, threw them back and saying these are wrong. Was told to wear them and get used to them, and sure enough, after that you couldn't do without the astigmatism. So it's some good memories that come back and going, wow, that really happened to me, and this is what I'm doing to my patients. So yeah, there's lots of look backs and hindsights that make you realize that something was always knocking on your door, that there's something else out there, and it didn't feel right, but you're trying to do the right thing that you were being taught.
So it had been several years between graduation and this kind of realization that you really did want to do vision therapy. How did that come about?
Well, it was the responsibility of one of my office people, my office manager, Jennifer. She decided to find another revenue source for the office that was outside of the optical, and she decided to sign herself up for VT1 through the OEP courses out in California. And partway through that whole process, as she was booking flights for herself, that she realized that the doctor has to be taking the arts and science program, and fortunately, the arts and science program was going on simultaneously in Michigan with Bob Hohendorf's office. And so we, at the same time, did two OEP curriculum courses and came back, two people with the same mindset that, boy, we have to change something, and things actually do happen in an office when you have two people rather than just one person coming back with new ideas. And Jennifer is one of those people that just gets things going and implements things and makes worlds change to get things moving, and she did. And I had my OMG moments where, oh, I've created harm to my patients, I have to fix it, how am I going to do this? And it's been very, very rewarding. I'm really thankful we went down that road. And we believe in education. We believe in educating all of our associates as well as our staff members. And we currently have 3 vision therapists at the office. And I have Dr. Kristen Poser, Dr. Shirley Haw, that have taken the OEP courses, and I have 2 other associates that are also in the process of going through trying to get their arts and science this year.
Wonderful, wonderful. And do you, when you started vision therapy, did you start small, one afternoon? Any advice you can give to a graduate, or I was going to say either a new graduate or an established doctor who's wanting to start therapy in their office? Any pearls of wisdom, things that you did that you wish you didn't do?
I really appreciated the case reports that I could do through the OEP, because the first thing that has to change is the type of examination and type of prescribing that you do. So I had a high volume office. I was seeing patients in a rather rapid progression. I have lots of delegation with pre-testing and retinal imaging and lots of staff in terms of dispensing. So I was able to delegate a lot of the testing, but I needed to take more time in my exam room. So the first order of business was to reduce the number of patients I was seeing per hour to allow me to do that in an adequate fashion and without interrupting the whole flow of the office. I also required that I had to hire another doctor on to take on the extra flow so that I could have the time. So I guess my biggest regret is to do such high volume. That it was a hard change to do at the start. It does affect your office revenue, and that's difficult at the beginning. But in terms of which patients are going to get that type of exam, you've soon come to realize that everyone requires this type of exam, but we pretty much started with the learning disabilities, the people with the obvious strabismus and amblyopia, and Jennifer took care of everything else. She tore down walls and created a VT room. She ordered all the equipment. She just takes charge and she makes things happen, and she knows if we have the equipment and the proper staffing, then it looks professional, and we're confident that we're doing the right thing. So we really plunged into in-office right away, and we did, oh goodness, it was hard at the start. It was not an easy transition, but Jennifer has a psych background. She has a master's psychology, so she understands the whole therapy process, and she was excellent at reaching out to Rob Lewis and getting the right process. I think the biggest mistake we made is overwhelming everyone with our new philosophy. Trying to explain that after 12 years of practice is kind of hard too. But to develop it into several different appointments and not doing it all at once was crucial for people to ingest the new information. And with time, the confidence came, and like I said, the case reports really, really helped. The feedback.
Now, for someone who's never taken an OEP course, can you explain how the case reports work?
Yeah, so the arts and science program requires a process of what we call a 21-point examination. And it's pretty much most of the things that you do in a regular exam, just in terms of understanding the different values in different places for this exam. So you use a particular form, you fill out the case on that, which is really helpful because rewriting it in a format that's not generally your exam form makes you look at a patient and a case differently, and you start to understand things better as you develop through the writing process of copying these things over into different format. And you submit it and you get a response back from the OEP, from one of the doctors that looks through it. And you do a phone consultation going through the case, which is fantastic. I get so much feedback back, such great insight. It's actually frightening how much someone on the other end can know about your patient without them actually seeing your patient.
So these are live patients that you've done your examination on, and you pretty much are looking for someone to lean on, to bounce things off of, which may be hard in an office where you don't have someone who you can bounce things off of. So you send this information in, and then one of the doctors pretty much gives up their time and gets on the phone with you and helps you work through the case.
It's one of the best benefits of taking the OEP courses is that support. I don't know how many people actually use that, but I found it beneficial. I think I was sending a report off every week, and spending 2-3 hours on the phone with doctors going through it. It's nerve-wracking at the start because you really feel that you don't know a lot, but it's very supportive and you learn a lot, and all of a sudden within a month, if you do it on a regular basis, you have the support of the language to speak to the patients and the parents. That's not just from your own perspective, but from someone else's perspective. And the technical support to do a treatment plan is fantastic, as well as the proper lens prescription to discuss that you're not going to create harm with a therapeutic lens option. And I found that so invaluable that I really appreciate the case reports, and I still send them off.
And can you tell, so obviously you're going to be coming onto the board. How did that process go about? Did you show interest? What were I guess of all of the optometrists and all of them in the world, how did you get to be on the OEP board?
I have absolutely no idea. It was a complete surprise, but I was very honored. I think I was really taken by the courses right off the bat. I did them in quick succession. I think I completed all of them within a year or under a year's time frame. And I showed interest that I would be interested in lecturing if that ever came about. And that's quite the process. I knew that would be a long frame to work in order to get the type of knowledge base that Paul, Bob, and Rob have shown during their lectures, and now John. It was a surprise to me. I think as a group up here in Canada, we've really done a lot of promotion to get more doctors to be involved with OEP in terms of taking the courses. I didn't realize that, yes, I did have such a big influence to get more people interested, more people doing it, but we did start our first Canadian Vision Therapy Study Group recently. We had Rob and Greg Kitchener up to help us start that in a proper process. And we have 2 other meetings already set. We're having Bubba coming up and doing our retinoscopy one in June. So we are we're just a growing group of individuals that are extremely excited about doing vision therapy here. It is considered new here in Canada. It isn't new. I know there's practitioners that have been doing it for years, but there is a big buzz to get it going. And unfortunately, our School of Optometry here in Canada, the Waterloo School of Optometry, has a different process on how they work with that, and we'd like to get involved with getting their students interested in OEP, and that there's more to learn. And so I don't know how it happened, but I'm glad it did, because sometimes you need a kickstart to become more of a leader, and I'm glad they asked me.
And do you have any ideas or issues that you'd like to see addressed very early on, or are you going to kind of maybe sit back and listen for a little while and figure out what's happening? What do you think your model is?
I think right now I'm just learning. I'm learning more about what the OEP stands for. I'm learning about, ICBO and the connections with different organizations and the promotions through the student programs. So right now I'm just learning and listening and seeing where my help is needed. I think the extension portion of the optometric extension program, I can see Canada as being one of those extensions, and I'm happy to be a motivator for that end. I know we have great doctors here all across the country that are involved, and we want to be a good, strong unit that has programs coming up here. Traveling costs are much less for our staff to be educated if we can get the lecturers up here, and I think we've shown some great support of getting groups together to make that happen, and I'd like to see that continue and grow.